Hi everyone, Erica here with Harmony Home Medical, and this week we're going to discuss patient lifts and transferring your loved one out of bed. Last week we talked about the different kinds of beds. This week we're going to discuss how to get them out of bed safely and how to make it so they don't have to sit on that sling all day long. So let's go. Okay, so we have two main types of patient lifts. We have a traditional patient lift that a lot of people call Hoyer, kind of like we call a copy of Xerox. They were the first brand to make one. So this is what we see most often when we get a lift through our insurance. Of course, it's not powered like this one, but it's our traditional patient lift. And then we have a sit-to-stand lift. And this lift does what it says. It takes a patient from a seated position to a standing position. So these are the two patient lifts we're going to talk about today. And they fill pretty much all of the patient lifts you see on the market's two categories, traditional and sit to stand. Other than these, you have ceiling lift, but for floor lifts, they all can fall into one or the other category. Beyond the lifts, we have the slings. And the slings are a big deal. So a lot of people will get a full body sling and they will accept that and use that because they've never seen anything else. Now, full body sling works great and it has its place. My personal sling is a divided leg sling. Divided leg sling performs the same task as a full body sling when we're using it with the patient lift, but you can take it off when the patient's in the chair. So we're going to demonstrate how to use both of these. And then for our sit-to-stand lifts, they have standing slings that go around the waist and then lift the person up. So there's never any rolling or lifting of the patient, and you can take them off when they're in the chair. So we're going to show how both of these work, and most important, how to put that sling on and how to safely take that sling off. Okay, so first we're going to use the traditional patient lift and a full body sling. Even in full body slings, we have a lot of choices. So here's a mesh full body sling. Here's a full body sling with commode opening. So they're using this, kind of like a divided leg sling works, but when they can't use a divided leg sling. And then we have full body sling in fabric. So 3 different kinds. But right now, since it's a little lighter, easier to manipulate, I will do the full body sling and mesh, but they all go on the same way. So I'll put these aside and we'll work with our patient, Victoria. So to put the full body sling on, you need to scrunch the sling, roll it up, and scrunch it up against the patient as much as you can. Scrunch it under their body while their weight is still in the bed. So we'll go like this, fold underneath them or onto the side of them, and then we are going to have them roll. Now this may be easier, this may be difficult. You can cross their leg over and then roll their weight, and then they can help by holding the handrail, or maybe they can do it on their own. And we bring this underneath them and do that scrunch. Then we have them roll back, go to the other side of the bed, and do the same thing. We can cross their leg over if it's difficult to roll, and help them go to the other side. And then we pull it through. So the sling is here. We want to make sure that we can get all of our straps clear and that we get the sling as flat as we can underneath them. So then we have them roll back, and it's set. So there's a little bit of work in manipulating the patient, and if someone's heavy or very unable to assist, it may become a 2-person transfer. So every situation will be different, but that's how we get the full body sling underneath someone. And then we would connect it to the patient lift. Now some patient lifts have 3 connectors, some have a single one. They all function the same. What you want to do is put the straps where you want, how you want the patient to be positioned, we'll say. The shorter you put the strap on the front end, on the head part of the sling, the more upright the patient will be when you lift them. And with the bottom, same applies. The shorter you put it, the more crunched in their knees will be, or the longer, the more laid out they will be. So we'll put this on, and we want our color straps to match. Most slings will give you these options of different colors, and it's not super important which one you're selecting as far as patient positioning, because all of them work, but you do want them to match so you don't have a sloped, I guess you'd say, transfer. So I'm going to put this one on green. Right now, with where I have my lift, let me bring it down a little bit. Also, this lift was already down. You want to bring the boom down over the patient, and you want to always watch out for the boom itself. This can become a weapon if it's swinging around and you're not paying attention. So always make sure that this is clear of their face. So we bring it down close, and then we can connect the lift or the sling. And we're going to go purple on the top ones and green on the bottom, and we just want to match both sides. There we go. And with a full body sling, they'll come up, but with the divided leg sling, which we'll do next, I really feel like they get into that seated position more, which for me, as a caregiver, I would prefer. Okay, so we're purple, purple, and green, and green. And whether we had one or all three here, it wouldn't make a huge difference. It will position them a little bit, but as long as our straps are matching, we're good to go. Okay, so I'm going to power the lift up. If you have a hydraulic lift, all the same rules apply, except instead of just pushing a button nicely, you're going to be doing the lever. So I would do this, I'm going to come back over here. I would do this always closer to the patient, make sure that their head is safe from the boom, and that all their clothes, arms, everything is clear as we're lifting. Just make sure they're not stuck on a rail or something on the chair, and make sure they're clearing as they start to lift into the air. So now she's up, and you would go to your chair or your other surface, and we can see positioning here, she's kind of sloped back. So when we transfer into our other surface, we're going to use these levers to pull her weight back to try to get her bottom back into the chair. But again, I like that divided leg sling because it gets a little more 90-degree position. And I'm going to show you that next. And we'll go all the way down into a chair. One more tip before I do that. When you're transferring somebody, and I'll move this so we don't hit any bed rails. If we were going to go down into the chair and it was just me transferring by myself, we'd have her spin this way, and we always have to watch their legs here. And sometimes it's a little difficult if we have limited range of motion in our knees, or if they have really long legs. You have to kind of bend and push your leg out of the way, and then use your hand to put weight on their knee and push them back into the chair. Because otherwise, you're going to get them in the chair, and they're going to be sloped out, fallen out already. So we would push back and bring the lift down at the same time to get to a seated position. Move the whole lift. So if that was her wheelchair, she'd be coming down in a more upright position than if, back up, than if I were not doing that and she's coming down like that and she's already falling out of the chair before we even get started. So put weight on that knee, get them back in the chair, and that's how you can do it independently, by yourself. In the hospital, they have 2 people doing it, but we don't always have that luxury at home. So I'm going to transfer back onto the bed, and then do the same with the divided leg sling. I'm going to go here. And another thing that I didn't do, which I would recommend, is use the brakes. And your lift doesn't go all over the place. Okay, so we will come on down. Okay, so once we get our patient or loved one back over the bed, then we put our brakes on the lift. And the powered patient lifts will have the brakes. Nowadays, a lot of the manual or hydraulic lifts are not putting brakes because they say that if the patient swings to left or right, they're not heavy enough to not flip over, so they want them to move. I think they do functional key with brakes. And here at Harmony Home Medical, we can add them on after the fact, but they don't come standard anymore. So we'll bring her down into the bed. And this part's pretty easy peasy because we don't need to achieve any special position in the chair, and we'll just let the lift lower her back down. You want to have their bottom kind of anchor the point where you want them to land, to be the landing point. All right, so our lift is down, and we'll take off our sling. And that's pretty much it with how to put the full body sling on and transfer them. But when you get that, oops, I got a double loop. When you get that person into the chair with that full body sling, it's all the way underneath their body. So it's staying on because they're sitting on it, and you can't roll somebody when they're in their chair. So for people who have pain in their legs or some other limitation that they can't do the divided leg sling, they'll have to sit on a full body sling, and they're going to have to be really cognizant of your heat and your seated environment. So that means be on a pressure preventative surface, like a Rojo cushion, a gel foam may be okay for some people, but we're already adding a layer of fabric which causes heat and friction, and those are all factors that play into getting pressure sores. So when we can, we want to remove that and keep the skin dry and cool and not having things sliding around on it. So that's why I prefer the divided leg. Sometimes it's not an option. So we'll go ahead and take this off, and then we will show you how to do the divided leg sling and a full chair transfer. Okay, so next we're going to go over the divided leg sling. So this is a divided leg sling, and they call it that because the legs are divided. You'll also hear the term U-sling or universal sling, and that's because it can be used across many different patients, and it's also shaped like a U. So this you can use with someone, well, you need to use with someone who can sit up a little bit or who can get the sling behind their back. So if someone's pretty able-bodied but they just can no longer bear weight and cannot stand on their own, maybe they're sitting on the edge of their bed, that would be the best way to get this sling on. So if we have a full electric bed or semi-electric bed where we can utilize the power articulating head, we'll use that to bring the person up. If we don't, you can help the person up to sitting and then be able to put the sling behind them. Now, a lot of people using the divided leg sling can sit up just like Victoria can, and they can help you with this. If they couldn't, if they have limited trunk strength, you can still, go ahead and lean back, you can still get this sling behind them ready. And this is where the hospital bed really helps, so because doing this while they're laying down and holding them, that gets hard. But if you had the hospital bed, you've got their head up, you can lean them forward with your own strength, because just leaning the upper body forward really isn't that difficult. And then push this sling down behind them. And just how we kind of shove the sling of the full body underneath the edges of her side, we want to do the same here, right at the top of her bottom, to scooch that sling down as much as possible. And then go on the other side and even out the legs and make sure that that's scooched down as well. I like to add one more layer of feeling secure for the patient by crossing the straps underneath their legs. You can do it like this, or you can even cross the straps through each other, and then it's definitely blocked for anyone to slide down, which they don't, but it can make somebody feel better. So we come back around and we'll attach the lift. And now, if someone's very able to help, you can be doing this while they're sitting up on the edge of the bed too, facing you this way, making it even easier. With the patient lift, this swivels and articulates so you can utilize it either way. Cross the bed this way, as we're going to do, or this way with them sitting on the edge of the bed. So we'll bring this across, or here. We want to bring it close to their body, in the middle of where those straps are. Again, watching for placement of our boom. In this case, they're going to be sitting up, so it won't be right by their face. And then we attach the straps. Same thing applies. The shorter the attachment in the strap, the more upright the upper body is going to be. So with a divided leg sling, we're transferring into a wheelchair. I really like to get the person as upright as possible. So I'm not trying to correct their posture when they get into the chair as much. And then with the lower legs, it's not as important, but I would like to push a little bit past where this line is just slack. Like pull it taut and get a little bit closer of a leg crunch than just splayed out. So we'll come down the other side, match the length that our strap is on. So we have it on the shorter strap up top and on the second strap below. And sometimes you have to really pull it up. So we're gonna go here. Over to get it to match. Yeah, kind of have that tight. But so now we're on the same length. We'll have our legs up in a good position and our head upright as possible. So let's go power her up. And I highly recommend, if this is an everyday event for you or your loved one or someone you know, have them consider a power lift. It is not that heavy doing the hydraulic one, but it sure is a lot on your shoulder every single day. Boom, boom, boom. The power patient lift makes it way easier. So this is one style of divided leg sling. And this one has great fabric. It's very washable. However, it has limited choice on our strap lengths. We have some other ones that can get our straps up even shorter and get us more in that 90-degree position even more. So then we're going to roll to the chair. And also, smooth floors, non-carpeted floors make a big difference. You open the legs of the lift with the lever. They have that power too, but it's really usually not necessary. If you have carpet in your home and you're moving somebody around, even a light patient, it can be really daunting. So I would recommend changing your flooring if you can. And if you can't, buy really exaggerated office chair mats. Those hard plastic mats that you put underneath a rolling office chair. You could also make a little pathway for your patient lift if that carpet was really high ply and difficult to roll on. I've done that for people before. So now we have our chair here. We're going to spin Victoria around. And the chair is easier to move and manipulate than the lift in this case. If it was a lift chair or some big chair, maybe not the case. But so I'm just going to shift where I had my chair rather than reposition my lift a bunch and bring her in close. So I'm bringing her down in the lift, and there's one thing that you can do with the powered lift that you also can't do the hydraulic, because I'm not attached to the lever here. So I'm going to cheat and go around to the back, and I can actually do the handles when I use the powered patient lift to do the pull back. Handle or knee, either way. But the handle gives you a little better leverage. The other method works for both, but it's the only method if you have a hydraulic lift, because you can't reach the lever and get back there. With a powered lift, you can. So we have her down in the chair. Make sure that their legs, feet, arms are clear, face is clear of this when you're bringing everything down. And she's in a pretty good upright position. Most of the time, patients will have to reposition a little bit. When they do, if they don't have a lot of strength, you can get behind them and do 1, 2, 3 and pull them up. Otherwise, a good rule of thumb I like to tell my clients is nose over toes, lean forward, push the bottom back. Get their body weight forward and push the bottom back into the chair. So they're in a good, healthy position as they start on their day. And then you can detach the lift and roll on. Okay, so now we're detached. We would take the lift away. So take the brakes off and roll it away. And then my favorite part about the divided leg sling, and I'll move the chair a little bit so you can see. So we can just take these straps out from underneath each leg, lift a leg. If the patient can, they can do it. Lift their own leg up and do it. But even if they can't, it's not hard to lift just one leg. But what is hard is to lift someone's entire weight off of a sling or fabric that's under their bottom. But this one's not. So we just help them lean forward and we pull it out. And then we have our divided leg sling is off. And they're on their chair directly, safe seated surface, reduction in pressure sores and heat, and more comfortable. Right? Because that's what it's all about. So there we go.
So next week, we're going to check that one out, the sit to stand patient lift. I hope to see you then. And any questions before then and now, or on any of the things we covered today, call Harmony Home Medical or visit us at www.harmonyhomemedical.com. Thanks for watching.